If you've heard that with pelvic physical therapy that it might involve an internal exam, you're probably wondering what that actually means. So whether you're curious, you're hesitant, or you're feeling unsure about starting pelvic PT because of it, I'll walk you through exactly what to expect, why it's recommended, and how it can help you. I'm Dr. Alex Hill. I'm a board-certified physical therapist, and I specialize in pelvic health and oncology, and I'm here to help take the mystery and the fear out of those pelvic PT exams. A pelvic exam in pelvic health physical therapy or pelvic PT is a gentle assessment of the pelvic floor muscles, the nerves, the joints, and the surrounding structures. It can be done vaginally or rectally depending on your anatomy and your symptoms, and it can be performed on any gender. Importantly though, this type of exam should only be performed by a licensed healthcare provider like a physical therapist who has completed advanced post-professional training in pelvic health. It's highly specialized, and examinations and treatment should always be done with your full understanding of what it is and your consent to do it. So let's first be clear that, again, you are in control of your care. You have the right to say no to any part of the exam or treatment at any time. And yes, that means even if you've already started that internal exam or treatment, you can request to stop it if you need to. Consent is not a one and done thing. This is ongoing. Additionally, you can and should ask questions or bring up any concerns beforehand or during the session. And finally, you can request a chaperone who'd be a trained staff member to be present in the room. Some physical therapy clinics may not always have one available, but it's an important conversation to have with your provider before you start your physical therapy sessions. So what actually happens during an internal pelvic exam? So we're gonna go through a step-by-step overview so you know exactly what to expect. Step one is privacy and preparation. So you'll be asked to undress from the waist down in a private room, and you'll be given a sheet, a gown, or both of them to cover yourself, and your PT will step out while you change and get ready. The next step when they come back into the room and start the exam is doing an external assessment. So this is going to involve assessing these outside tissues and structures, so checking the skin, the tissues for any changes, irritation, scarring, or sensitivity. We'll assess the reflexes and the pelvic floor movement, so we'll have you contract, relax, and then push out so we can see what that mobility looks like. And we can also palpate these muscles. So we have here the vaginal opening and the anal opening. We can palpate all of these muscles and structures around this area to see if they reproduce any of your symptoms or if there's any issues at those muscles or those tissues. Now this is a model with a vaginal opening, and so we can also do these external and internal exams for somebody who has a penis. So we have those same superficial outer pelvic floor muscles, structures, tissues, and genitals that we can assess, and we'll do that initial assessment based on what your symptoms are and what your concerns are. Once they've done an external assessment and they communicate their findings with you about how they may be impacting your function or symptoms, then we would do that internal exam. So if you're getting a vaginal exam, you're typically going to be positioned lying on your back. You can request for pillows to be under your legs to help with some support. Your pelvic PT may also need to do an assessment with you in standing, especially if they're going to be assessing for any pelvic organ prolapse. Now, if you're getting a rectal exam, again, regardless of your gender, you might be lying on your side so your therapist has easy access to the rectal canal, or you could be lying on your stomach for easier access. But again, this is something that you'll talk about with your pelvic PT with what both of you are comfortable doing. And so with your consent, the pelvic PT will use a glove and a single lubricated finger to gently assess internally. There's typically no stirrups or speculums, though these could be used, and nothing is inserted without your permission. And so with that internal assessment, so they're going to be assessing all of those muscles and structures, if there's maybe scar tissue in there, any radiation fibrosis, And if any of these muscles or structures or nerves reproduce your symptoms like pain or urgency, that can definitely be stemming from somewhere in the pelvic floor. With that rectal or vaginal exam, your pelvic floor physical therapist will also assess your pelvic floor functioning. So how strong can you contract? How long can you contract, or your endurance? The coordination, so can you quickly contract and relax your pelvic floor muscles? And especially if you have overactive and tight muscles, how well are you able to relax them as well? So this is a pretty thorough exam to really see how your muscles are functioning, and are there any other structures in that pelvic bowl that might also be contributing to your symptoms. And then with assessing for pelvic organ prolapse, they can feel and assess and see, are those organs starting to drop down into the vaginal canal? Again, this can be done with you lying on the table or with you standing, so that they can better assess those organs and the tissues as well. With this comprehensive external and internal exam, your therapist is going to have a much better idea of what's going on, what's driving your symptoms, and what kind of treatments would be helpful for you. After the exam, your PT may start working on pelvic floor exercises with you, or doing some manual therapy to address any examination findings. And at the end of this visit, your pelvic PT will step out, so then you can get dressed. Then you're going to come back together and talk about what they found, what it means for your symptoms, and what is your individualized treatment plan going to be. And remember that internal exam and treatment are not required to receive pelvic PT care. There are many other external, movement-based, and behavioral approaches that can still be very highly effective if you're not ready, or if you don't want to do those internal examinations and treatments. Internal pelvic exams can feel vulnerable, but they can also be incredibly empowering when done respectfully and with care and good communication. You deserve to understand your body and feel supported every step of the way. If you have questions, drop them in the comments below, and if this helped ease your mind and have a better understanding about what to expect, don't forget to like, subscribe for more pelvic health education that you can trust.